Restart a Heart demonstration video. Do you want to learn how to do CPR and safely use an automated external defibrillator? Follow this step-by-step guide. By developing the skills and confidence to follow these simple steps, you could be a lifesaver in an emergency. Before you approach the person who has collapsed, check your surroundings for danger.
Joe? Joe? You alright? Claire! Help! Claire, come here, Joe's on the floor!
Step 1. Shout for nearby help and then check for a response. Speak loudly to the person who has collapsed and, if appropriate, gently shake or firmly tap their shoulders. Step 2. Look and listen for signs of normal breathing for up to 10 seconds. Look for the rise and fall of their chest. Step 3. Ask a helper to call 999. Or, if you are a lone rescuer, use your own phone to call 999 and put the phone on loudspeaker. Tell them you are with someone who is not breathing and immediately start CPR, assisted by the dispatcher. If you do not have access to a phone, you must leave the affected person to go and ring the ambulance service. Alert the ambulance service first and then start CPR. Step 4. Start chest compressions. Place one hand on top of the other and interlock your fingers. Place your hands in the center of the chest. Push down hard and then release twice per second. And don't stop. The ambulance call handler will help you with this. If you are trained to do so, after 30 compressions, provide 2 rescue breaths. Alternate between providing 30 compressions and 2 rescue breaths. If you are unable or unwilling to provide ventilation, give continuous chest compressions. Step 5. The ambulance call handler will tell you where the nearest automated external defibrillator, AED, is. If someone is with you, ask them to fetch it and bring it back. Do not leave the person if you are on your own. Step 6. Switch on the AED and follow the instructions.
Unit OK.
The defibrillator will tell you exactly what to do. Attach the electrode pads to the person's bare chest, according to the position shown on the AED or on the pads. If more than one rescuer is present, continue CPR whilst the pads are being attached. Ensure that nobody is touching the person whilst the AED is analysing the heart rhythm.
Don't touch the patient. Analysing.
If a shock is indicated,
Shock advised.
ensure that nobody is touching the person.
Don't touch the patient. Press the flashing shock button. Shock delivered.
Step 7. If you are feeling tired, ask someone nearby to take over chest compressions. Try to minimize any interruptions to chest compressions. Step 8. Continue giving CPR until the AED asks you to pause while it reanalyzes and gives another shock if needed. A paramedic arrives and tells you to stop, or the person shows signs of life. Learn CPR today. Your actions could save lives.